So the first neurological test we are going to be performing for the lumbar spine is going to be the slump test. And this is one of the best tests that is going to help us to place tension on the dura and reproduce any neurological signs if this is what that patient is experiencing. Next, we're going to instruct the patient to place hands behind their back. Once they do that, they are then going to move into a slouch position and make sure they bend their head down. You will also want to place your hand on top of their head to hold down, but don't apply too much pressure. Each time we change a position, we're just going to see if their symptoms are reproduced or those complaints are reproduced. Next, passively extend the knee, and this is going to help to increase stress on the dura, and then if we want to even increase more stress, we can then passively dorsiflex the foot. During this, if the patient states that their pain or symptoms are being reproduced, then you want to have them next actively extend their head. When they actively extend their head, you then want to ask, did this make any changes? So if yes, if their pain went away or if their symptoms or complaints feel better, this is a positive slump test because you took the stress off the dura. If when you extend the head, this doesn't change their symptoms or complaints, then it's a negative test and it's probably hamstring tightness. So again, a positive test would be the position reproduces those complaints or symptoms, and then when they extend the head, those symptoms go away. So now we are going to be performing the sympathetic slump test, and this is done when examining the thoracic spine, and you see that your patient is having signs that sound more autonomic or things involving the sympathetic nervous system, such as sweating. So you can bias the normal slump test by putting stretch on the sympathetic chain. So first thing you want to have it do is have your patient in a more long sit position like this along the table. And remember that you test to the opposite side. So in this case, we're going to be testing the right side. So I'm going to have Jasmine bend her right leg, and then we will side bend and rotate to the opposite side. So first thing I will have her do is put her hands behind her back, then slouch down as much as possible with her head down. And now if I want to check again the right side, which is what we're doing, then I'm going to have the patient side bend and rotate to the opposite side, which would be the left in this case. Then have the patient slowly straighten her leg out, and if it's positive, you may reproduce their symptoms or complaints. You may also get a sympathetic reaction such as sweating. If when the patient extends their leg, that's as far as they can go, you can have them look up as well. So a positive test is if you get a sympathetic reaction in this position. In this case, that reaction could be sweating. So a straight leg raise is another neurological test that can be performed to check the dura of the lumbar spine. So first thing what we are going to do is we are just doing a standard straight leg raise. So this one I am going to start by passively lifting the patient's leg on the side they are having complaints of. So what I do is I put my hand below the ankle, and I want to then put my hand on the knee to kind of make sure that this stays straight, and I'm going to passively lift up the patient's leg. And now as I lift up, I want to get to the point where she says, those are my complaints, or that's my pain. Then I'm going to lower the leg back down out of that until the pain goes away. Then after that pain has gone away, I want to bring back those symptoms. So in order to do this, we can dorsiflex the ankle, and if her pain comes back or those complaints, then you want to ask the patient to lift the head up, so chin to chest, and then you want to ask if there are any changes. And if she says that it is worse, that is because we increase the stress on the dura, making it a positive straight leg raise test. If she says the pain feels better, then maybe it's just more hamstring tightness. So that was the standard straight leg raise, because with that one you grade the test on which side you are working on. So in Jasmine's case, we were working on her right side because that's where she felt her symptoms. Now, but if we are testing the right side and the complaints come down the left side, we're going to perform the same test. So what we're going to do is I'm going to passively lift her leg up. She says, oh, that's where my pain is, but instead of feeling it on the right side, she's feeling it on the left. So I'm again going to lower it down. Want to put more stress on it. I'm going to dorsiflex, same thing that I explained earlier. Then I'm going to put her head up. And remember, as I lift that head up, she states that the complaints are going down the left side of her leg, and those are reproducing her symptoms. on the left side, so that is a crossed straight leg raise, and this is typically a prognosis that is usually worse. So now we are going to perform the femoral nerve traction test, and this test is basically going to place traction on the femoral nerve, and it is indicated for numbness and tingling or pain in the area of the femoral nerve distribution, which would be the anterior portion of the thigh. So I'm going to be testing the affected side, or the side she's having her complaints or symptoms on. So in this case, I'm going to test the right side, which is the side that is up. So I'm going to make sure I stabilize kind of her hip/ASIS area. And then I'm going to pull the hip into some extension, which is going to begin to put some traction on that nerve. And then I want to pull the knee into flexion. So as I pull the patient's knee into some inflection while maintaining that hip extension, if it is a positive test, it is going to reproduce the patient's complaints when I flex this, but also in order to be positive, when I let off and bring that knee out of flexion, the complaints will go away. So this would be a positive sign of the test again if not only she feels the complaints when I bend the knee, so that reproduces those symptoms she's been feeling, but then those symptoms go away when I extend or bring that knee out of flexion. So now we are going to move on to a special test that is typically done when there is suspected lumbar spine instability. And there are two different ways to do this test. One way is if your table adjusts, then you just want to make sure that you can pull the hips into extension by raising the table up. So in order to do this, you just want to make sure that the patient's hips are going to be in line with that kind of break in the table. And then you can raise the back of the table up to put the patient in the correct position, and that kind of saves your body mechanics. But if the table doesn't adjust, like the one I have here, then what we're going to have to do is do it ourselves. So in order to do this myself and to put the patient's legs into extension, I'm going to have to grab a hold of the patient's legs, and I'm going to provide the extension by lifting the legs up about a foot off the table. And typically you want to try to hold that position for about 30 seconds, and you're just looking for the patient's complaints of heaviness, and this would be a positive test. So when I raise her legs up, if she complains of the feeling of heaviness in her legs, and then if I lower the legs down and those complaints of heaviness go away, that's a positive test. So once again, lift the legs up, complains of heaviness, lower the legs, she says that goes away. That's a positive passive lumbar extension test. So now I will be performing the prone segmental instability test. And this is another test that can be performed when you suspect instability of the spine. So what I'm going to do is the patient is going to be positioned like this over the edge of the table with feet on the ground. And then I'm just going to have to lift up the patient's shirt and inform her that I'm going to be placing my hands on her back and just kind of feeling her spine. And let's say I've already identified that I suspect an instability around the L4-L5 region. So as I do this, I'm going to now palpate along iliac crest to make sure that I am on L4-L5 region. So as I continue to find this, now what I'm going to do is I'm going to do a PA glide at L4. And as I do that, she says that she is good and does not reproduce any pain or symptoms that she's been feeling. So then what I'm going to do is I'm going to move upward and do L3. I'm going to do a PA glide on L3, and the patient says that that's painful, that's reproducing those pain and symptoms that she's been feeling. So then keeping my hands where I am as I do this PA glide again, what I want to do is have the patient have her hands on the table, and then what she's going to do is she's going to raise her legs off the ground, and as she lifts her feet off the ground, I'm going to repeat that PA glide. If the patient says it feels better and the pain or her symptoms went away with the feet up, that's a positive test, because when the feet come up, she fired all of the muscles to stabilize her spine. So a positive test is if she feels those complaints or symptoms while her feet are on the ground while I'm performing a PA glide. Then in the same area, she's going to lift her feet up. I'm going to do the same PA glide again, and those complaints should go away or feel better, which would be a positive test. Another special test, if we suspect an instability problem, would be the H&I test. And these tests are going to allow us to also examine the patient's quality of movement as well as determining if there's any sort of instability problem. So they're named after the motions we are going to do. So they're called the H and I because we're going to have the patient move into a capital H as well as a capital I position. Make sure that we watch the patient from the side and the back view while we look for any aberrant movements or changes in symmetry. So first we are going to start with the H test. So in order to make that, the patient is going to side bend to her left. Then staying in side bending, she's going to bend forward into flexion and then come back and bend into extension. Then she's going to come back to neutral. Again, side bend now to the opposite side. Keeping that side bending motion, bend forward into flexion and then back into extension. And that creates the capital H. And remember that this is a positive sign if you reproduce the patient's complaints or symptoms in any part of the motion, or if you see any aberrant movement or loss of control. Now moving on to the I test, it is the same concept except we make an I, so she will bend forward into flexion, then she will move to the right and to the left, then she will come back up into extension and move to the right and left. And the same thing as the H test, positive sign if there's any loss of control in movement or she reproduces those complaints in any of those positions. Another instability test for the lumbar spine is going to be called the anterior spine instability test. So we are going to suspect that there is a problem at L4, L5. So what I'm going to do is I am going to make sure that Jasmine's hips are in about 70 degrees and knees in 90. Then I'm going to palpate iliac crest and find my way over to the L4, L5 region. So as I palpate, let's say that I have found it and I am now on L4. So I will put my fingers on the superior aspect, which is L4, and make sure again have the patient's hips in 70 degrees of flexion and knees in 90 degrees of flexion. And then as I put my fingers on that superior segment and stabilize, I'm going to use my hips and stomach, and I'm going to push against the patient's knees while stabilizing the superior segment. As I do this, the lower segment is pushed posteriorly, which is going to be a relative anterior glide of L4 moving on L5. This test is positive if when I do this, this reproduces the patient's complaints or symptoms, or they feel any heaviness in their spine or legs. So another test for suspected instability of the lumbar spine would be the test for posterior spine instability. So with this test, you want to begin with the patient and sitting with their legs off the table, just like this, then have them rest their forearms on my shoulders. So let's say that we want to check the L3, L4 region. So then I'm going to lift the patient's shirt and I am going to find iliac crest and then kind of follow my way back so I know I'm about L4, L5, and then I will confirm I'm on L4, and then I will stabilize the inferior segment with my fingers. Then as I stabilize that inferior segment with my fingers, I'm going to instruct the patient to push her arms into me as if she's trying to push away. And as the patient does this, it creates a posterior glide of the superior segment, which in this case is L3. This test is positive if this reproduces her symptoms or complaints, any feelings of heaviness or clunking. So now we are going to be performing the quadrant test, which is a special test for joint dysfunction, but more specifically looking at the facet joint. So what this test says is going to use combined motions to try to reproduce the patient's complaints or symptoms. So typically for these patients, when you perform in one plane, such as flexion or extension, it's not going to produce their symptoms. So we're going to combine motions to try to reproduce their symptoms or complaints. So what we're going to do is instruct the patient, say with her right hand. I want to place her right hand on the back of her right thigh, and then she's going to slide her hand down her leg. And we're looking to reproduce those symptoms or the patient's complaints of pain when doing this test. And the combined motions are going to be of side bending, rotation, and extension. And it's a positive sign if those complaints of pain or symptoms are produced when doing this motion. Now you're going to be performing the bilateral is she's going to be lying in supine just like this. And what you're going to instruct the patient to do is lift both legs off the table simultaneously, and they should be lifting them about 2 to 4 inches off the table and holding it anywhere between about 10 or up to 30 seconds. So you're going to instruct your patient, I want you to lift both your legs up at the same time, just a little bit off the table, and hold it for as long as you can. I won't have her hold it for that long, but that's just how you would instruct your patient to do it. And according to the McGee text, it would be a positive sign if the patient is unable to hold it in either both limbs or the affected limbs, as well as if their symptoms or complaints of pain are reproduced. That would be a positive test as well. So now we are going to do the stork standing lumbar extension test. So basically, I'm going to have the patient face me, just so they can get a better view. And you're going to be testing both sides, and then depending on what side the symptoms kind of come on can tell you if it's more of a spondylolisthesis or a problem with the pars ventricularis instead. So how this works is I'm going to ask the patient to lift her left leg, so she's going to stand on her right foot, and then I want her to go back and do some extension. Just hold it in case she loses her balance. Good, and she can come up, and then she can put that leg down. You're just going to ask did that reproduce any of your symptoms or complaints. And then you also have to test the other foot, so now you're going to stand on the other foot. Good, and again, she's going to go back into extension, so lean back, and then come back up, and relax. And same question, you're going to ask if that reproduced any of those signs and symptoms that she's been feeling. So now we are going to be performing the 90-90 straight leg raise test, and this should typically be performed whenever there are any sort of lower quarter complaints. So we always want to check the length of these muscles. So this test specifically checks the length of the hamstrings. So what we're going to do is place our position in 90 degrees of hip flexion as well as 90 degrees of knee flexion. And then what we're going to do is passively extend the leg up while trying to maintain that 90 degrees of hip flexion. Normal would be within 20 degrees of full knee extension. And if you can't reach this amount or it's close, you can typically use a goniometer to determine the degrees to make sure you're exact. So if it is not within 20 degrees, then it's a positive test for hamstring tightness. You also want to make sure you compare the left side. So you're going to do the same thing, 90 degrees hip and knee flexion, extend, and remember normal, which would be a negative test, is within 20 degrees of full knee extension. So if the patient did not get that amount, if they were less than that 20 degrees, then it's a positive sign for hamstring tightness. So another test we can do to check for muscle length is called the Ober's test, which is going to be testing the length of the IT band. So we're going to have the patient side lying, and you want to test the side that is on top or up. So in this case, we are testing Jasmine's left leg. So you also want to make sure that the patient is really rolled over more forward so that they're going to be over their trochanter. Another important thing is to make sure you stabilize the ilium, and as I'm stabilizing, I'm going to pull the hip into extension while keeping the leg straight. After I do this, I'm going to instruct the patient to have their leg drop down towards the ground or towards the table. Jasmine's leg does go all the way down, so this would be a negative test for IT band tightness. But if the leg does not go all the way down and it stays up or more parallel like this, then this would be a positive test for IT band tightness. So again, a positive test for tightness in the IT band is if the leg does not drop down. So now we are going to be performing the rectus femoris test, which is going to have us check for tightness in this muscle. So what we're going to do is first we want the patient to kind of sit their butt on the edge of the table. And as she does that, you're going to instruct the patient to kind of roll back onto her back. So she's going to lean back. And as she does, I want you to tuck your knees to your chest like this. Now I want the patient, if I'm testing the right leg, I want Jasmine to hold on with both hands to her left leg. And I'm going to control this leg. So as the patient's in this position, I'm going to hold on here. I'm going to come in and stabilize her hip around her ASIS. And what I'm going to do is I'm just going to passively let her leg kind of drop. And what we're looking for is as her leg drops, you can see that Jasmine is angled pretty much down towards the table. So that means that there's no tightness. But if it was more up a little bit or more parallel, and I wanted to make sure there was no tightness, what I could do is I could take her leg and bend it, and it's as I bend it, her leg pops up like this, then that would be a positive test for tightness and rectus femoris. You can relax. So again, so when you bend that knee when she's in the position, if the leg pops up, that would be a positive test for tightness and rectus femoris. But as when she drops the leg, if it's kind of more parallel or leg is off more so the table, then it's a negative test. Okay, so now we are going to be performing the Thomas test, which is a test that allows us to determine if there's any tightness in our hip flexors. So what we're going to do is have the patient lying in supine like she is now, and you want to make sure that if I am testing the right leg, I'm going to have Jasmine bend her left leg, and then she's going to use her hands to kind of hug her knee and bring it to her chest. As she does this, as we're testing this leg, the right leg, you can see her leg didn't come off the table and it's nice and flat right here and touching. So that means it's a negative test and there's no tightness in iliopsoas. But if Jasmine were to do this and pull her leg and it comes off the table, or there becomes a slight bend in her knee like this, then that would be a positive test for tightness in iliopsoas. And she can relax. So again, if the leg doesn't move or come off the table, there's no tightness in iliopsoas, but if it does pop up, it's a positive test. So the next special test is going to be for patients that have more so back or hip complaints. This is called the sign of the buttock test. So it's very similar to the passive straight leg raise test in the beginning. I'm going to passively raise the patient's leg up until she states that's where she feels her pain or those complaints and symptoms. Then I'm going to bend the knee, which is going to take stress off the hamstrings. And when I bend the knee, I want to see if I can move them further. And typically I should be able to move them further like this if I bend the knee. But if I do the same thing and as I bend her knee, I'm not able to move her any further, this is a positive sign and it can indicate something bad such as a neoplasm or fracture. And I'm not going to be able, if it's a positive sign, to move her any further because pain is going to be that limiting factor. So again, a positive sign is if I'm unable to move her any further when I bend the knee because it's reproducing that pain or those complaints. So a special test that we can use to check for thoracic spine instability would be what's called the sitting arm lift test. So what you're going to have to do is have the patient sitting and make sure that they are facing away from you. And you're going to begin with the uninvolved side first. So ask the patient to raise their arm overhead, kind of leading with their thumb. And you're just kind of looking to see if there are any problems with control or this is reproducing any of her symptoms. But this is the uninvolved side, so it should be fine. So then we're going to move to the other side, and let's say in this case, Jasmine's right side is the involved side, so this is done second. And same thing, as she raises her arm, you see that there's loss of control or patient complains of the pain or symptoms she's been feeling, and she also may be feeling that in the thoracic spine area. So then I'm going to go around that area that you suspect the problem that I've kind of already figured out with PA glides or just from the patient complaints. And what I'm going to do is ask the patient to kind of lift her shirt up, and as she points to her pain, that's just what I'm going to stabilize. So kind of putting my thumbs on the thoracic spine and ribs in this kind of motion. Then as I stabilize the thoracic spine and ribs, again, I would have the patient lift the arm up again. So stabilizing her ribs and thoracic spine via the area I've already suspected a problem via PA glides or patient complaints. And as she lifts that arm up again, if the motion improves, so there's a better control or quality of motion, or symptoms have decreased or alleviated, this is a positive sign for instability in the thoracic spine. So once again, a positive sign is if when I stabilize the thoracic spine and ribs as she lifts her arm up again, the quality of movement is better or it decreases or takes away her symptoms. So now we will be performing the prone arm lift test, which is similar to the seated arm lift test, but this is typically used for patients who have more difficulty with overhead activities. So this again is another test for thoracic spine instability, but it's a little bit more aggressive because you're going to have to lift the arm against gravity. So you're going to have the patient lying in prone and have their arms straight out in front of them. Again, you want to test the uninvolved side first. So this case is Jasmine's right arm. I have her lift up her arm. She has no complaints or any of those symptoms coming back. Then we're going to move to the involved side. And as she lifts her arm up, that reproduces her symptoms or complaints, or there is difficulty in the control of motion or movement. So lower that arm back down. And then again, after she's lifted that arm up and I know that's the involved side, let's say I am suspecting the problem, which I have already determined by PA glides where the area in the thoracic spine it is. So since I've done my PA glides and I've already determined area, I'm going to go into that area and I'm going to stabilize the thoracic spine and ribs. So I'm going to kind of put my thumbs on the spinous process, and that's going to help me to stabilize the spine and ribs. Then as I'm stabilizing, I'm going to have the patient lift the arm up again, and if it's a positive test, that would be when the symptoms are decreased or there's a better quality of motion. So again, a positive test is when she lifts her arm up when I'm stabilizing, her motion has improved in quality and control, and her symptoms have either decreased or gone away. So now we are going to be performing the reflex hammer test, and this is a test that helps us to examine bony integrity. So typically you can do this test if you're suspecting maybe a fracture or the patient has some sort of history or trauma which leads you to suspecting a fracture, or maybe they have osteoporosis. So it just helps you to examine bony integrity. So what you're going to be doing is using this reflex hammer, and you're just going to kind of go down and tap along the spinous processes, or find the area where the patient is complaining of pain, and you're going to tap on those spinous process and see if that elicits any of their symptoms or pain. So I'm going to have Jasmine lift her shirt up, and again I'm just going to palpate with my fingers to find the spinous processes around where her pain is, and I'm just going to give them a couple little taps. And I'm going to kind of move down and kind of do the one below and do the one above, and just kind of tap a couple of them and see if any of those reproduce her pain. So if I tap on one and Jasmine feels pain or tenderness, then this is typically a positive sign, and I want to refer out and get imaging or anything like that if this is positive, because it could be a suspected fracture. So now we're going to be doing the Murphy's percussion test. So basically this is just a test to help us rule out if there is any sort of problem or injury with the kidneys. So how this is going to work is you want to start with the uninvolved side first. So let's say Jasmine's been experiencing her flank pain or any signs and symptoms on her left. So I'm going to start with her right. So what I'm going to do is I'm just going to use the palm of my hand. I'm going to kind of place it around where the kidneys would be, around her ribs. And I'm just going to kind of use my fist and I'm going to tap. And when I do that, since this is the uninvolved side, it shouldn't reproduce any symptoms. Now, let's say this side, which is her left side, this is the involved side. So she's been having, say, her pain kind of coming around here. So I'm going to place my hand on the ribs around the kidneys where she's been experiencing her pain. Use the palm of my hand. I'm going to use my fist to kind of just tap. And then, since that's a sign, that should reproduce the flank pain or whatever sort of signs and symptoms she's having in that area. And if that reproduces those symptoms she's been feeling, then that would be a positive sign that there is an issue with the kidney.